welcome everybody here. We're so happy to share our work with you. You'll meet our students in just a second. They are great about hearing our work. But before we get into the presentations, I will share with you briefly what it is that we do here at the UCLA Pritzker Center. So UCLA is such a fantastic and amazing place. We have the opportunity to work in a multidisciplinary way with so many amazing, brilliant people from law school, from medical school, from the public policy school, from the social work school, from the education school. We work with folks in the Semmel Institute, where Audra is from. We work with, as she said, Tyrone at the education school. Trisha Lester, one of our other faculty members at the Semmel Institute as well. Frankie at the Luskin School. Myself, I'm a lawyer by way of training, so we bring the legal perspective to this work. And we really have a lot of love for all of the different expertise that makes up our foster care system and that makes up really the types of professionals that our kids in foster care end up interacting with throughout their time in foster care. So it's really important to us to see this work from many different angles and through a lens of racial equity, of gender equity, of really how we can bring about opportunity for kids and families so that they can all thrive. We think about two big questions here at the UCLA Pritzker Center. The first is around how to prevent children from entering the foster care system. And the second is how do we support reform of the system for those who are already within it. And we do that through three main strategies. The first being research, which you'll hear about a lot from our team. The second being education, something like this, if you will. And the third being partnership, which again is really represented here today. We have the amazing Wendy Wexler here, our philanthropic partner, which we're super grateful for, from Anthony and Jeannie Pritzker Family Foundation, Pritzker Foster Care Initiative. We have some of you here joining us from UCLA, different backgrounds here on campus, and then we also have amazing community partners here as well. So this is how we like to make up the rooms that we're a part of with really diverse perspectives, and most importantly, with people who have direct experience and who can inform the work that we do here. I think that the last piece of our, like I said, work is really around partnership, again, exemplified here today. And the students will tell you a lot more about that in terms of how that comes out in the work that we do across LA County and really the region. So with that, I'm going to turn it over to the students, unless Dr. Langley has anything she'd like to add.
Oh, take it away. They're the highlight.
They are the heart and soul. So they're the highlights, and they'll tell you about what we do. Thank you all.
Good morning, everyone. My name is Brittany Hun, and I graduated from UCLA back in 2023 with a degree in human biology and society, and I'm currently applying to medical school.
Hi everyone, my name is Isabel Reyna, and I am a third-year undergraduate student here at UCLA, double majoring in public affairs and communications.
Hi everyone, my name is Olivia Gilchrist. I'm also a third-year undergraduate at UCLA, and I am majoring in public affairs and psychology.
So this is the team, including me and Missa, who couldn't be here today. We are the Avenue Initiative, and so the Avenue Initiative helps raise community awareness of kind of local resources, programs, and different events up in the Antelope Valley specifically. And we compile the Antelope Valley Health Neighborhood, which is one of our partners out there, their weekly newsletter, and we also share kind of these events online as well, our social media.
Yeah, so alongside our newsletter and our social channels, we attend community events up in the Antelope Valley to promote local resources for children and families. And our goal as a team is to be both personally connected to the community while also conducting research, to identify the greatest points of need among the community.
Yeah, so over this past summer, we began a new research project in collaboration with DHS and the UCLA UCSF ACEs Aware Family Resilience Network, UCAN, to provide community-level data on adverse childhood experiences, also known as ACEs, experienced by children in the Antelope Valley.
So ACEs include experiences like abuse, neglect, or other household challenges such as family separation, food insecurity, housing insecurity, or witnessing domestic violence, which we'll talk about a different project kind of in collaboration with that as well. And so experiencing ACEs can have a profound and lasting impact on a child's development and their brain, and impact their health and well-being for kind of years to come to adulthood as well. Bless you. Especially if children don't have those kind of supportive buffers in place.
So our work will focus on mapping the prevalence of ACEs in the Antelope Valley to inform and guide policymakers and community agencies on areas of greatest need. Our hope is that through this work and our continued partnerships, our team at the UCLA Pritzker Center can continue to identify prevention strategies and policy recommendations to better support children and families in their journey to healing in the AV. Thank you.
Hi everybody, my name is Sophia D'Souza. I graduated from UCLA in 2023 with a degree in physiological science, and I am currently applying to medical school, and I am a researcher here at the center.
Good morning, everyone. Thank you for being here. My name is Chris, and I am a third year here at UCLA, double majoring in poli-sci and education, and I am also a research assistant here at the Pritzker Center.
So we'll be talking today about our domestic violence projects, more specifically our 2 studies that we have conducted. I'll be presenting one, and then Chris will be presenting our most recent one. So the Child Welfare and Domestic Violence Report on Intersection and Action examined this complex intersection of child welfare and domestic violence, specifically in Los Angeles. Domestic violence is prevalent in over 50% of child welfare cases, and current approaches often lead to family separation, and that can really deepen trauma for survivors and for children involved. This report called for systemic improvements to address these issues more effectively, including targeted training for child welfare professionals, enhancing specialization within the workforce, and legislative reforms such as revising the failure to protect statutes, which currently penalize survivors of domestic violence for perceived failures to protect their children, even when the survivor is not directly responsible for the harm that has been done. Furthermore, this report proposed a dedicated domestic violence court pilot program to ensure a more consistent and trauma-informed approach to domestic violence cases in the court. These recommendations aim to prevent unnecessary removal of children, create a more nuanced understanding of survivor dynamics, and introduce more specialized support and new roles to provide expert guidance in domestic violence cases.
Thank you, Sophia. Our second project, called Collaborative Reform in Child Welfare for Families Experiencing Domestic Violence in the Antelope Valley, really sought to enhance their response to families experiencing domestic violence, or DV, and child welfare investigations in the region. In the region, we're in a region where there are high rates of child welfare referrals and significant social challenges. This initiative really was a partnership between LA County DCFS Lancaster office and also Valley Oasis, which is a local DV services provider. And then the real purpose of this project, research project, was to three things. One, it was to document. Two, it was to develop. And three, it was to evaluate. It was to document the experiences of parent survivors of domestic violence service providers, and child welfare staff. And then the second part was to really develop a collaborative response to the experiences of these people. And then the third was to evaluate the interventions that have been implemented. And then our study really highlighted the challenges survivors face, like meeting child welfare expectations after leaving abusive relationships, and barriers to accessing the services needed. We also evaluated 2 interventions by Valley Oasis domestic violence consultants for DCFS staff, and then we found that advanced training significantly improved DCFS staff's knowledge of domestic violence. And consultations also help them apply this knowledge when working with the families and children. And these findings suggest a need for further reforms across LA County in the areas of social and economic infrastructure to better support families experiencing domestic violence, including enhanced collaboration between DCFS and domestic violence agencies, specifically the local ones.
Thank you so much.
We are going to highlight a few of the studies we've done around racial equity. So I'll start with one. In 2022, we were approached by the LA County Office of Anti-Racism, Counseling and Inclusion to better understand the barriers to reducing long-standing racial disproportionality in Los Angeles County child welfare, specifically for Black children and families. And so we were able to conduct focus groups as well as key informant interviews with LA County DCFS social workers, with stakeholders, with community leaders. And I'll highlight just a few of the findings. One is what we really call structural intersectionality, and that is the ways in which our families are engaged under multiple systems and structures where involvement in one tends to justify involvement in another. So for example, a family might be involved in the criminal legal system, somehow that is then used against them to have them now involved in the child welfare system, sometimes the reverse. So those carceral entanglements were something that came through really clearly. And social workers also talked about the ways in which policies based on those things sort of tie their hands in some ways and create a great deal of moral distress. That is, they're having to make decisions based on rules and policies, even when they aren't sure that it's in the best interests of the child and the family. And so I think both policy and practice implications came out very clearly. Another issue that really rose to the surface was social workers and other leaders in the system feeling as if those who are carrying out various mandates do not really have an understanding of the historical impact of structural and systemic racism and how that plays into the lives of families. And so that's something that was also elevated. And really the need not only for culturally responsive and trauma and healing informed care for kids and families in LA County, but within these systems that people are really trying to work and strengthen families.
Okay. Thank you, Dr. Langley. So the second racial equity research project that I'm going to be talking about is the 2021 Courageous Conversation Study. So the Foster Together Network and the UCLA Pritzker Center embarked on a collaborative study through a series of quote-unquote courageous conversations. The study explored experiences, attitudes, and perceptions related to 3 points. Firstly, non-Black caregivers providing care for Black foster youth in foster care. And 2, receiving foster care services as a Black youth or family. And 3rd, training and support needed among non-Black caregivers caring for Black youth.
And the findings really identified the gaps in knowledge among non-Black caregivers that left Black youth exposed to racial microaggressions. With limited support for developing or even strengthening racial and cultural connections and identities, there was a lack of appropriate personal skin and hair care resources.
So recommendations included enhancing cultural competence and racial literacy among non-Black caregivers, improving accountability for the care received by Black youth, and requiring skin and hair care education for non-Black caregivers and resources for Black youth.
Lastly, we're going to be discussing the blind removals pilot. On July 13th, 2021, the LA County Board of Supervisors passed a motion authored by Supervisor Holly Mitchell to pilot blind removal. Blind removal aims to reduce racial disproportionality by removing racial demographics from the removal decision-making process as after an investigation of alleged child abuse or neglect.
And then our findings concluded that race does play a role in the decision making. Furthermore, despite downward trends in overall DCFS hotline referrals and removals, the referrals and removals continue to impact disproportionately Black and Latinx children and families.
So based on these findings, the UCLA Pritzker Center recommended that DCFS and other child welfare agencies actively engage in promoting upstream enhancements to target the root causes of disproportionality, like altering mandated reporting laws in practice. Additionally, we encourage child welfare agencies to dedicate ongoing resources toward cultural transformation, whereby training, policy, and practice normalize discussions about race, racism, and bias to attain equitable outcomes for families. Thank you.
We really appreciate your support, and just really, again, can't thank you enough for coming today. This is like really our dream here at the center, is to bring together everyone from the parents to our community partners, to our campus partners, to our philanthropic partners, our government partners, to bring to life our work. It really is what we're all about, and because of you, we're able to do it. So thank you for coming today.